This is the Money Hour with your host, Tina Mitchell, on Alternative Talk, AM 1150. Now, back to the show with local mortgage and finance expert, Tina Mitchell.
Welcome back to the Money Hour with your host and mortgage expert, Tina Mitchell, right here on 1150 AM KKNW, the Saturday, August 15th show. Each week, I share expert advice and inside knowledge on how today's events in our local economy can affect your money. If you're hearing my show at a different time or day, you are listening to a rebroadcast. But you can call the show at 1-855-400-1150. Again, that's 1-855-400-1150 or online at themoneyhour.com to discuss anything regarding finances, money, any guests that you'd like to see in studio, or more importantly, guests that I have in studio right now this weekend. And in studio for the first time, excited to talk with Sondra Earley with Muma Associates, Inc., discussing Medicare. Sondra, thank you so much for coming into studio. I ran into you at one of our networking events. Actually, Ian's part of it as well, and in really helping seniors. And I just listened to you get up on stage and do your presentation. And I thought, oh my gosh, I got to have her in studio. And then talking with you, found out that you've done a little radio on your own.
Absolutely. Thank you for allowing me to be a guest.
Of course. And a little background of Sondra has been board experience in design, production, and management of diverse organizations. She has been an insurance professional for over 15 years with a progressive experience in sales, security products, as well as healthcare, personal lines, and commercial lines insurance. She has a reputation for cross-marketing and new marketing development and is highly skilled at providing training, coaching, and consultation. She has proven success in management and project teams to achieve goals and objectives. And Sondra, I'm excited to talk about Medicare because I know that there's a lot of my listeners that probably could benefit from this topic. And if we could start out with sharing with my listeners what's happening new right now with Medicare.
Well, right now, you can only enroll in Medicare once per year, unless you have a special event or a different enrollment period. So Medicare is the largest healthcare organization in the nation with over 50 million beneficiaries. It's available for folks that are 64 plus, turning 65, or those younger that have disabilities. So right now we're in kind of the pre-open enrollment period.
Okay.
That begins October 7th and runs through December 15th of this year. So I have people calling me right now who are right within that window of 7 months, their birthday month and 3 months before and 3 months after, a total of 7 months, so that they can get their Medicare enrollment.
So it's time to take action, it sounds like.
Time to take action.
Yes. Now, what about what Medicare does not cover?
There are a number of things that Medicare does not cover. Medicare doesn't cover everything. It was never intended to do that. Let's talk about what it does cover.
Okay.
So, original Medicare covers the hospital services as well as B, Medicare A. That's Medicare A. Medicare B covers the physician's cost. Some of the things that it may not cover now would be such things as chiropractic, but there's a number of things, and that's why I'd like to sit down with folks and look at their personal health care needs and develop something that is tailored for their individual situation.
Okay, and everybody's situation is different in all areas. Again, it's just really planning and finding out what they need to do. Are you in the spirit of that? Are you telling your clients to retire or keep working, Sondra?
That's an individual choice.
Yes.
One thing that folks ask me all the time is, how long can I work? Well, that is dependent upon their own circumstance. Okay. So some folks are working beyond 70. If they are currently employed and they have over 20 other fellow employees in their organization, you want to check in with your HR manager to make sure that you are covered And the day that you decide not to be covered, that's the day that we need to look at when we're going to enroll them in a Medicare plan. If they have credible coverage almost to the end with their employer, good for them. But in some cases, when they turn 65, a couple of things are going to happen. At 65, you're going to get that letter from probably Social Security and maybe even before that says that you must enroll in Medicare Part A, the hospital. So if you had 10 years of working experience or 40 quarters, however you want to manage that piece of it, you are eligible, no doubt have paid into Medicare, and you're eligible for hospital services. So you would carry that anyway. So what's going to be primary may be Medicare, and then secondary may be your employer's insurance. Okay. At the point in time that you decide that you're going to not work anymore, or you need to check in with Medicare Part B. So generally what happens if you're working, Medicare Part B is going to be covered by your employer, and then secondary would be your Medicare. So healthcare covered by your employer, and secondary would be your Medicare.
Got it.
Okay.
And what about the cost, Sondra?
Cost is variable. So if you had worked 10 years, you're probably not going to pay for Part A. Okay. In B, you're going to pay a premium. Almost everybody pays. It starts at $104.50. But depending on your income, and if you're high income, you're probably going to pay more for the premium for Part B.
Got it.
So there's lots of details here and lots of reasons.
Well, I said got it, and I'm like, you know what? I don't know if I do get it. And that's why it's important for somebody to, for my listeners to really talk with an expert like you, because it can be kind of complicated.
Yes.
And you can make some financial or some wrong decisions.
Absolutely. So basically what we'll do is sit down and in a private conversation, talk about all the needs. So I'll do the needs assessment. You can tell me whatever you want to tell me. That's all private. That's personal information. We can do an in-home appointment. You can request seminars, or you can come to my office or have a phone consultation if you like.
Yeah. And I have to say, if you're out there and a business owner that's listening, having Sondra in, and again, I've had an opportunity to see her on stage, and you have quite a presence to you and a way of speaking and getting your message out. And I really didn't think that, Medicare and listening to a presentation could actually draw me in as that well. So very impressed with your speaking ability. So let's talk about understanding the original Medicare, Sondra.
Okay. So original Medicare, again, belongs to, there are two parts to it. It's Part A, Part B. As I said, Part A is the hospital insurance. Part B is the physician's insurance. Now, when you have original Medicare, you're probably going to want to have a prescription drug plan.
Okay.
So I say that gingerly because you will want to have your prescriptions covered. And the government used to say a few years ago, you must. And now they say you should. And if you don't, you will pay a penalty of at least 1% for every year or every year that you didn't sign up when you should have. So that's what original Medicare entails.
Okay.
Today.
And what about Medicare and what it helps cover? Can you break that down?
Sure. Let's talk about that. So I have a couple of notes here.
Okay.
So just to make sure we know. Part A, hospital insurance. Inpatient care in hospitals, including room nursing services and supplies. A stay in a skilled nursing facility. Home health and hospice care if they're medically necessary. Let's talk about Part B because I know it's very
Part
detailed.
A, Part B.
Part B, medical insurance. What it covers or what it helps to cover there would be services doctors provide in their offices and in the hospital.
Okay.
Services from other healthcare providers, outpatient care, home health care, and durable medical equipment.
All right. what about what it doesn't cover?
Okay, so let's take it
There's
from
got
the
to
top
be.
again.
There's got to be.
Let's take it from the top in
Okay.
case people were taking notes. So what it doesn't cover. So Part A, you're responsible for a deductible, okay? And the deductible that you will pay has to be met in each benefit period. For example, if you go to the hospital like three different times, each time is called a benefit period. So you're in for a period of time, you come out, you go back in, you still have to pay that deductible.
Okay.
And it's detailed out in several different tiers, let's call it. So you'll have a deductible for the first 60 days, days 1 through 60. You'll have another deductible, and it's less from day 61 to day 90, and maybe a little bit more in 91 days to 150 days of hospitalization.
Got it. And so talk about the important to explore your options, the A, B, C, and Ds
Absolutely.
of Medicare.
So, there's a variety of Medicare plans that are out there. If you get the Medicare and You book from Social Security, it's at least an inch thick. If you turn to the back of that book, you're going to see probably 256 different plans.
Wow.
I haven't counted them yet, but
my
it gets
gosh.
very confusing. So we haven't done a great job at teaching people or educating people what this is all about, so they come in very confused.
Yeah.
My passion is education, so that's what I really want to show you, the ABCs and Ds of Medicare. So we already talked about the A and B part. Let's talk about C. So what is C? C is the Med Advantage plans that we have now today. What happened was it got very confusing and very expensive over a period of time. So the government and the healthcare plans decided to collapse A and B and D, the prescription drug plan, into something called C, Med Advantage.
They just wanted to make things a little bit more complicated.
Right. But I teach A, B, C, D, so it works out.
So we're all
really well.
covered.
You're all covered. So often those plans, we'll call them Med Advantage plans, and that's what they are called. They will include A, B, and D, which makes it kind of one-stop shopping. So you're paying the bill once.
Oh, got it.
So it adds a little bit more benefits to Medicare if you're choosing a C plan, okay? And so they will come in different flavors, HMO and PPO. So the health maintenance organizations, those were designed to manage the cost. And what that means is you're going to have providers in a certain benefit plan. What I mean by that is that they're in a certain network.
Okay.
Okay, so you want to be sure that you know what network your physician is in. PPOs, just as in other days and other plans, that means that you can have a physician, you can select your own physician, and you do not have to have a primary care physician managing or gatekeeping your health care, which is what the case is in an HMO plan.
Okay. So when should my listeners enroll in Medicare? I mean, I know the enrollment time is
7 months, total 7 months when they turn 65.
Okay.
You should be thinking about this before 65, but for sure in that 7-month window.
Okay. So we've got a minute left, Sondra. What do you want to leave with my listeners on a tip that you can provide, something a most common mistake or things to watch out for to really help them?
Well, make sure that you kind of do your homework while you're thinking about this. Are you wed to your physician, or could you go to another physician? What is the total amount that you spend on prescription drug plans or care? Think about how much you're willing to pay. Because if you chose another type plan called a Medicare supplement plan, you're going to pay probably about $2,000 a year. So given all of the expenditures and the outlays, deductibles, co-insurance, out of pocket. You want to consider those things. Best thing to do, I'd say, is go to a seminar. There are plenty of free ones. You can request a seminar for your church or your local organization. I can certainly do that for you. Request an in-home appointment. I'll come out to your home. You can come to my office. You can call me up and ask me any questions. I'm available 8:30 to 4:30, Monday through Friday at 425-455-1406.
Wonderful. Sondra, thank you so much for sharing some important information about Medicare with my listeners, and great to get you in studio.
Thank you so much, Tina. I appreciate it.
You're welcome.